3.
Hi, my name is Scott, and I'm going to talk to you today about personal protective equipment, which is PPEs. So today we have gowns, N95 mask, a regular mask, and your latex gloves. So the reason why we need these is basically for different precautions that are in the hospital. So the hospital will have like a contact precaution, which you'll be needing to wear your gown and your gloves. And the reason why is just to protect you from contacts from like skin and other like just other diseases that can happen. So we also have the droplet precaution. You'll need to wear the eye shields, and then you can also wear gowns and gloves. And for airborne, you have to wear your N95 mask and your gown and your gloves. And for the airborne, you want to wear your N95 mask because the patient can have TB or influenza, like a flu or anything, and those particles can get into it can get into you and it can make you sick. So that's why you want to wear that. And then there's one more. So an isolation precaution is basically the same thing, but the room of the patient is the negative pressure room, and now you're gonna have to wear a gown. You have to wear your N95 mask, your gloves, and if you need to, your shoe covers and your cap. But those rooms are for basically tuberculosis patients because they need a negative pressure room with the HEPA filters. Okay, so I'm going to show you before you go into a room what to do. You're going to check the patient's charts and you're going to see what they have, if they're sick or like if they have any contact precaution, airborne precaution. In this case, we'll go with isolation. So before you put anything on, you wash your hands first for 15-20 seconds, or you can use hand sanitizer. You can use both, hand sanitizer and then wash your hands. So after that, you're gonna go and you're gonna grab N95 mask and you're gonna put it on like this. So the way I do it is I grab the bottom one first. I'm gonna put it over my face. I'm gonna put it behind, pretty far behind. Oh my God. Okay, and then this one I put it over my first ear. And then you have this part right here that you want to like squeeze. You want to make sure that it's like sealed so nothing can get inside. And you'll know that you're putting on pretty much right when it's really hard to breathe, because it's hard to breathe right now. Like, okay. And then after, you're gonna put on your gown, and you want to make sure that your gown doesn't touch the floor. So just keep it up and high. And then you have this part that goes around you. Okay. And you want to tie it in front so it's easier to take off. Okay. And then the back part. I hate putting this on. Okay. So once that's done, you can go and put your gloves on. I'm a large, if you wanted to know.
Oh, yeah, I'm like, oh,
These are your regular gloves. They're not your sterile gloves. They're still clean though. After they're on, you want to make sure you put them kind of over your gown, just to, like make you, I guess, more safe. You won't get like, yeah. All right. So after you're done, now you're ready to go into the patient's room. So when you go in, you do what you need to do, get it done, and then when you're walking out, the way to take this off, I kind of do it differently because I have glasses on. So usually you take off the gown first, you rip it off, but I'm not gonna rip it off. So take it off like this, and then you roll it away from your body, and then I'm gonna take one glove off as I'm pulling it away from my body. Dang, no I didn't. Okay. There we go. Okay. Cool. And then you're gonna take my glasses off into the clean room. Grab it here. Pull it out. Okay. Then make sure you're not touching your contaminated areas, and then throw it away. After that, you fix my plugs. Go back to the wash the sink, and then wash your hands for 15 more seconds. I would say use hand sanitizer, but honestly, clean your hands because it's gross anyways. Just clean it 15-20 seconds, wash it, sing your birthday song, and then that's it. Walk out.